Hello orthopods. Today we'll be talking about developmental dysplasia of hip. Before going into the topic per se, let us talk about a small story. Okay? Long ago, this was known as congenital dislocation of hip and congenital dysplasia of hip, because during those times the diseases were named based on their presentations. So a patient who present with these conditions had dislocation of hip and dysplastic changes over the acetabulum. So people thought it is a congenital disorder, so they named it as congenital dislocation of hip and congenital dysplasia of hip, etc. and so on. So later on, when they realized that this is a disorder that grows through age, so then they have renamed it as developmental dysplasia of hip. So without any delay, let's just dive right through the topic. Okay, so first we'll discuss about the definition, incidence, associated disorders, presentation, diagnosis, finally treatment. Okay, so first coming to the definition, it is subluxation, that is partial dislocation or complete dislocation of the femoral head from true acetabulum and acetabular dysplasia. Okay, so coming to the incidence, why do we need to know about the incidence? Because the incidence tells us the load of the disease. Okay, and it also tells us that how many diseases are being diagnosed and what is the if we are able to diagnose them very early, it will be of a better help. Okay, so 1 in 1000 live births on physical examination, this is the study done. Okay, on physical examination when done by pediatric doctors, it was 8.6 per 1000 live births. When done by orthopods, it is 11.5 per 1000, and when done using ultrasound scanning, it is 25 per 1000 live births. More commonly, it is a bilateral condition. If it is unilateral, left side will be more commonly involved than that of the right. Okay, so in females it is more common, that is 5 times more common in females than that of the males. More common in the firstborns, high risk in if the family history is present, that is about 10% more risk. And now coming to the associated disorders, it is more commonly associated with neuromuscular disorders such as congenital torticollis, metatarsus adductus, talipes calcaneovalgus, etc. So there are some other things in this. There is something called as teratologic or prenatal hip dislocation, which is seen in arthrogryposis, and other syndromes associated with arthrogryposis such as Larsen syndrome, Freeman-Sheldon syndrome, dystrophic dysplasia, etc. Okay, and the other neuromuscular disorders this is associated with is spasticity, muscle imbalances, cerebral palsy, myelomeningocele, poliomyelitis, etc. Okay, so now there are some theories proposed in order to explain the disorder. Okay, so the first theory was mechanical theory. Mechanical theory states that the position of the baby in utero decides the position of the baby when it comes outside. Okay, so if there is a crowded babies, that means multiple babies. Okay, or if there is low amnion, or if there is a breech presentation, so all these conditions can lead to different positions of the baby in utero. So and hip can get dislocated. Okay, so the next thing is hormone induced joint laxity. Okay, the mothers actually produce a hormone called relaxin, which is useful for muscle relaxation in order to cause a better and smooth delivery. Okay, so but the relaxin has the capacity to travel through the placenta and act on baby also. So when it acts on the baby, the joint capsules and the ligaments become very lax, and that can lead to easier dislocations. Okay, and next the other proposed theory was primary acetabular dysplasia and genetic inheritance. Genetic inheritance says that family history and also other chromosomal abnormalities associated with syndromes. Okay, so now let us see about what is teratogenic hip dislocation. Teratogenic hip dislocation is what I am talking about, the dislocation of the hip which has occurred before birth and it is irreducible even after birth. So this is because the dislocation is very high riding. Okay, so the false acetabulum will also be seen very early, and stiff hip dislocation at birth will be present, and it is also associated with neuromuscular problems such as congenital dislocation of knee, rigid equinovarus, congenital vertical talus, etc. Okay, so in such conditions, if the dislocation is very high, it will be very difficult to reduce it. So one of the tests that we do in order to reduce and check whether the hip is dislocatable or not is a test called as Ortolani test. Okay, so in this Ortolani test, we try to reduce the dislocation. Okay, so here the Ortolani test will be negative because it is a very high dislocation and irreducible. So why there is a dislocation and why is it not getting relocated? So in order to understand that, we have to understand some things that goes inside the hip joint. Okay, so let us talk about that hip joint. So at birth, if there is an unstable hip, what actually happens? And we also told that the ligaments and capsule have become very lax because of the relaxin hormone. Okay, so they become elongated. The capsule and the ligamentum teres becomes elongated, and during that time, when the femoral head starts to go in and out of the acetabulum, what actually happens is a ridge of thickened articular cartilage is formed on the acetabulum. Okay, so this is called as neolimbus. What actually happens is when the femoral head starts to go out and in, the neolimbus starts to turn inward, that is into the joint. So due to that, when the hip is dislocated outside, it will be very difficult to reduce it back due to this neolimbus. So after the neolimbus has occurred, the ligamentum teres, we all know that it has become very thickened and it has become elongated also. Okay, along with that, the inferior capsule, transverse acetabular ligament, iliopsoas, all these muscles start to stretch and they form hourglass contracture. Okay, the neolimbus which has inverted, the inside of that acetabulum becomes completely flattened and it gets filled with fibrofatty tissue, that is called as pulvinar. Okay, so due to all these conditions, the hip relocation becomes very difficult. Okay, let's stop our video here. Thank you for listening. Kindly like, share and subscribe. So in the next video, we'll talk about presentation and diagnosis. Hello orthopods.